Okay, so hello. I think I will start my talk like Brian started his talk and saying, I'm not sure why I'm here, because I'm going to talk about two projects, one of which I used to be involved with, and another one which Vlad, Vinny, and I are adjacent to at CZI. And so I also feel kind of bad because we just heard about cool space data, and the first thing I'm going to talk about is cancer. But not really cancer. I'm going to talk about cancer data. So there's a little bit of a difference. These are kind of my disclaimers here. So I am currently a program manager at CZI on the imaging program, where I oversee our frontiers of imaging programs. I am a former science policy fellow, which is where I got involved with data management and data science. And I'm a former professor where we generated a lot of data, especially as a facility director. What I am not a current federal employee, which means I am not currently working on one of the projects I will talk about. I am not on CZI's science technology team, which is a software development team who developed the other project I'm going to talk about. And I'm not a CZ Imaging Institute employee, which is what the other part of talking about the second project. So just to give you some groundwork where we're coming from. So first I want to talk about a project which started about 10 years ago. In fact, the 10-year anniversary was celebrated a couple years ago. And one of the missions of the US National Cancer Institute is to make cancer-related data more freely available to anyone who wants to look at it. And so anyone who wants to look at it has a very broad definition in their eyes. And so that could be people from a patient who has just received a diagnosis and wants to learn more about what this disease means, what does it look like in the case of imaging, to clinicians who have a more complex view of that question, to developers who want to write software to help it now and analyze genomes, proteomes, images, and a number of people kind of in between. And so in order to kind of address all these populations, they came up with this idea of a project called the Cancer Research Data Commons. What the Cancer Research Data Commons is a cloud-based resource in which several different types of data are included. And so we can see some of them up here. We have genomic, proteomic, imaging, clinical. Now we have epidemiological and clinical trial data. The Cancer Research Data Commons also includes canine cancer data because of the parallels between human cancers and dog cancers. And what they did is they decided we're going to put this all up in the cloud. And some of the reasons for doing that are, one, while people have access to data, they may not have access to compute resources which are amenable to studying large amounts of data. And so when I first went to the NCI, I kind of thought of cloud resource as a place where you put cat videos. But it turns out that, yes, it is a place where you put cat videos, but it is also a scalable computing resource. And so you can make the amount of compute power that is needed for many different tasks available to anyone who has access to the cloud. And so this is just kind of an example of some of the approaches they have taken for this. They want a web interface because it is in the cloud. They have APIs for more advanced users, software developers to interact with the data. They have secure workspaces, so you can look at cancer data, but one thing that people will do is bring in their own cancer data from their studies and study it side by side with this publicly accessible data. There are also the analytical tools to do this and workflows, so Jupyter notebooks and other workflows for different resources. So, of course, there are these different resources. The first, which came online about 7 years ago, was the Genomic Data Commons. It now has, I think, around 50,000 human genomes from cancer patients within it. The second resource was the Proteomic Data Commons, which came online about 5 years ago. And about 2 years ago, the Imaging Data Commons came on board, or the IDC. I'll slip, and I'll sometimes call it IDC, but what I'm really referring to is the Imaging Data Commons. When we first started thinking about the CRDC and eventually the IDC, these projects kind of rose out of the ashes of a failed project that the NCI had taken several years before, where they took a top-down approach to making data accessible, and they didn't really think about the needs of the community. And so that flamed out and burned very quickly. So we decided we need to talk to the community. And so we did that in two different ways. The first way is we went and talked to imaging scientists at the NCI to see what kind of data they were generating and how they're using that data and how much of that data they're generating. The second thing we did is we wrote a request for information, or an RFI, sent it out to the community and said, we want to build this resource for imaging data related to cancer. What type of data do you want? How will you use it? And what do we need to include? And so we got about 32 responses to that RFI. Those responses range from 100-page white papers from several large corporations who explained to us in detail why we should use their platform for setting up these resources, to this comment, which was encouraging but not enlightening. Luckily, most of the responses, people talked about different user cases, thinking about different ways they would use the data. And so that kind of informed how we would write the next step of the process, which is a request for proposals, which is slightly different from a request for applications because this is more of a contract based on building a specific resource. Going into the RFI, we had an idea of how people would want to deal with interoperability of cancer-related data. And so we kind of thought about that as imaging data as a whole. They'll want interoperability with genomic data, and they'll want interoperability with proteomic data. Kind of thinking about that going forward, after we heard back from potential users, there were clearly two groups of imaging data people. People were thinking at the cellular level, and people were thinking at the medical imaging level. And while they both wanted interoperability with genomic and proteomic data, at the time, so this was 7 years ago, they didn't necessarily want interoperability, or what I would call interoperability, between different types and different scales, both temporal and spatial, of imaging data. I will say that if we were to do this again today, with the rise of projects like Human Tumor Atlas Network, with the multimodal techniques we heard about here, I think the answer would be very different now. That this need for interoperability between different imaging types would be much more prevalent than it was in 2017. One problem with all of that is that different images of the same tissue are taken by different people with different instruments for different reasons. And so all three of these images are images that contain cancer tissue. One problem is that, like I said, they're all collected by different people, so different people use different names for data. They also can use different names for how the metadata, how you describe that data. And so these are three different ways how a renal cancer is described. And so one resource that exists at the National Cancer Institute is the NCI Cancer Thesaurus. And so when I first arrived there, I was given a task to go visit the people who ran the thesaurus, and they said, give us a cancer term. And so I thought I would pick a fairly rare cancer called rhabdomyosarcoma, which is a muscle cancer that often occurs in young children. When we put that in, 75 responses popped out of the thesaurus. And so thinking about harmonization of data, even at that level, is really difficult. So, of course, because this is a national resource, an open resource, thinking about FAIR is crucial to how the NCI operates and makes this data available. And these are just examples of how they approach across the CRDC, making the data fair. And so they take fast keyword searches, which can go across the different data types. They make multiple visualization tools available at multiple levels with software, APIs, et cetera. Interoperable, standard data types. Genomic data uses dbGaP, for example. For images, DICOM is used. All the data currently within the Imaging Data Commons is medical imaging data, and that was something we wrestled with initially, but realized very quickly that because imaging data was going to be initially most prevalent, go with DICOM, don't mess up the system. And it has to be reusable, so there's a lot of metadata buried on top of that. Thinking forward and thinking personally, it was great to twice hear about care. And so this data also needs, going forward, to think about care. I'll skip this. This is just as you think about different types of data resources and the audiences that you work with them, your priorities change. And so like keeping data for long periods of time is very important when you're dealing with large resources compared to project resources. And this is from a paper written by a bunch of NCI staff earlier this year, thinking about how you deal with data repositories. Medical imaging data, anything in there has the problem of PHI, or privileged health information. That has to be removed. And so the way that the imaging data common gets around that is they take data from other resources which have previously scrubbed the images both within the metadata and the image itself for personal information. This is a good example. This is an image as I saw it on the web when I wanted to show a knee MRI. When I downloaded the image and put it into a slide, it turns out that this was a cropped version of the image, which I could download. And up in this corner over here was a name. So you have to be very careful. In the United States with HIPAA, that's a $50,000 fine each time it occurs. And so you have to be very careful. Good news is the new algorithms are getting much better. They're now at 99.5% efficiency at removing information from the images themselves. Is it being used? Yes. And so these are just some of the statistics from earlier this year. There's about almost 10 petabytes of data within the Cancer Research Data Commons as a whole. Of that, about 170 terabytes is imaging data in form of MRIs, CTs, and X-rays, and now a little bit of digital pathology. People are using this, over 2,000 years of compute time, and 82,000 unique users. I just want to put these names up because these are people who are still working on CRDC. These are the authors from 4 papers which came out in the AACR journal earlier this year celebrating the 10th anniversary of the project. So another smaller project, one that we are undertaking at CZI, is the CryoET data portal. So you've probably heard of CZI. CZII is the CZ Imaging Institute, which is a physical research institute which was initiated about 2 years ago with the goal of taking on grand challenge projects that cannot be handled within the scope of normal academic institutions. And so one thing they realized very quickly is that we're going to generate a lot of data, so we need to have some sort of portal. And part of working with imaging data around CryoET is making it harmonized so that you can bring in the AI and ML experts. So they set up this portal. They thought about it. Again, they thought about who the users are going to be, and they came up with 4 particularly unique types of users: generators, developers, and insight formers. This is a unique project. At CZI, we have this theme of build, fund, do. And so all 3 teams are involved. CZII, our software developers, and the funders, because the portal was seeded with images from investigators who we paid to harmonize and put that data in there. This is just an example of what was done. So once this data was harmonized and put into the resource, Roots Ermel at the Institute looked at 13,000 tomogram series, and in 3.5 days, using membrane, segmented each of those tomograms. And so this is just an example of one of his tomograms that he did over that time. And in a second, it will pop out to show some of the other ones. So this was all done in 3.5 days, which for annotation is very fast. So that's just to give you an idea of several different ways to approach portal construction, but the parallels of thinking about, begin with the end in mind, and think of who your users are going to be. And so these are just codes for the 3 different portals, and I'll take any questions.
Thank you.